Good morning, YouTube. It's around 8:30 in the morning here in Tijuana, Mexico, and I am with Dr. Freya. Hi. And he is taking me for my pre-op work and do a walkthrough of the hospital and facilities, in particular to his cosmetic facilities where he does the cosmetic surgeries, and he's going to make me beautiful after I lose all my weight. And then hopefully speak to some of the doctors, get to meet everybody, and I will be recording as I go along. So I'm going to bring you with me. All right, we're here, Tijuana, yay! Okay, I'll talk to you soon. So the hospital is this whole area, and this is the lobby area.
Yeah, right here.
And we're now in the elevator.
Almost 25 rooms, and we have 4 operation rooms over here.
Mm-hmm.
We have the recovery room. It's 4 beds also.
Mm-hmm.
And we have a room from therapy, emergency, like Lucy.
Oh, okay, like an ICU?
Yes, exactly.
Fantastic.
Over here's the room. We have 6 rooms over here.
And these rooms are the regular rooms?
Yes.
Okay. We're going down the hall.
With the red card for any emergency.
Emergency red card.
Over here we have another small operation room. This part.
Oh, okay.
For endoscopies, the small procedures, not the big ones. Also, it's with her recovery room. Okay. The principal operation room is in the 3rd floor.
On the 3rd floor is the principal operating room. Okay.
Here's another area for US. But we have a base
ICU. Oh, okay.
So we have everything here for something.
So you all are prepared, and people don't have to be moved to another facility? Oh, that's fantastic. Oh, wow, this is very nice. And look at the area for my husband to sleep. He's going to be very happy, yeah.
Personal.
The full bathroom. Fantastic.
Here's
Hello.
Dr. Leon.
Hello, hola, Dr. Leanne.
He's internist doctor. Normally he do the ovarian test and all that.
Okay.
So
I'm going to go ahead and grab some paperwork here and get started with Dr. Leanne.
Hola.
Hola. All right, I'll be right back, guys. So the doctor is going to introduce me to another doctor who works here and who apparently speaks English very well, although I have to say they spoke English pretty well. So I'm going to get a chance to speak with one of the doctors and understand a little bit more about the facilities and what they offer, their services, etc. So, see you in a minute.
Ya le expliqué todo.
Hi, hi, Dr. Raquel.
Hi, how are you?
This is Dr. Raquel. Thank you so much.
You're welcome.
It was
Hi.
great meeting you.
See you.
Do you mind if I?
No, it's fine.
Okay, all right.
fine.
I'm a little. Hi, we're here. Do you want to sit anywhere in particular?
If you want, we can sit here.
Okay, great. So I know one of the things that the YouTube viewers would really like to hear about is the process.
Right.
So they get kind of a run through of what happens and what to expect when they first come in, and
You
the
mean
kind
like
of blood work.
when they come into the hospital and everything? Like
Yes,
From
so
the beginning.
From the beginning.
Oh, okay.
Yeah.
Okay. Well, in this hospital, what they do normally is first of all, they you come into the reception and they take your information and everything, and then they assign a room for you.
Okay.
So that and then when they take you to your room, and then one of us, because we're the house doctors
Okay.
from the hospital, like there's always a doctor 24/7.
Could you define and differentiate a house doctor from?
Okay,
You're
so-
saying from the surgeons?
Yes.
Okay.
The surgeons come. They're your medical treaters. As, we're like caretakers.
The primary care.
Primary care. So what we do is we take care of all the patients that are hospitalized.
Okay.
So in case of, because the doctors who do the surgeries cannot be here the whole time to check them out and everything, because they have other surgeries, they have consultations and stuff. Because they do come to see them, but it's not like
They come in to
it's
check in on them.
It's
Yeah,
not 24
they can't
hours.
monitor them 24/7.
So we always have somebody here that monitorize everybody else. See all the patients that are in here. So what we do is we come in and we ask them a whole bunch of questions they already been asked to see if they're allergic to anything, just to make sure that everything's okay. If they have any health conditions, to make sure that we can take care of that in case something happens. And basically, and so then the nurses come and they prepare them for surgery. And if they need blood tests, we take blood tests. If they need an internal doctor to do the VPO before the surgery.
What's a VPO?
Valoración preoperatoria. Let me see. The cardiologist, when they do the EKG and all that kind of stuff. Okay, so we can get somebody like Dr. Leal, who's there, and then he comes.
So he did, like, Dr. Lau did an EKG on me just now.
So
Okay.
they do all that kind of stuff.
Okay.
And then they prepare them to put the IV, burn surgery, and everything. So now then they go to surgery, and that's about it. The first thing, and then when they come out. For example, if they come out when I'm here in the morning, I go see them to see how they are. So first of all, when they do, even if it's a bypass surgery against the sleeve, or if it's like a balloon, you have to expect that you are going to have like it's gonna hurt.
Yeah,
because of the gas.
Pain, yeah.
You're gonna be in pain because it's laparoscopico.
Yeah.
So they have to put gas in your stomach
To be able to see
be
everything.
able to see everything.
Yeah.
So when they come out of surgery, you're gonna have gas still in your stomach, so you have to burp.
A
You're
lot.
gonna fart and all that kind of stuff.
We don't like farting.
It's pretty normal. I've seen worse.
I have a quick question.
Yes.
So if somebody is on medications, regular medications, do you guys provide those while they're in the...
Yeah, you can either bring them with you, or we can provide them.
Okay.
There's a pharmacy in
So
the
they would
hospital.
continue to receive that
Yes.
medication if necessary.
For example, if somebody's a diabetic and you come and do the gastric sleeve or something, obviously you're going to need insulin. We're going to be checking out the glucose, so we put insulin in case that you need it.
Okay. So then you come in and you check on them, make sure they're doing okay, and you check
Yes.
their pain level?
Yeah, we check their pain level. We check how their drain is going, if they're not bleeding, if it's if the incisions are okay, if they are burping, because that's very important.
How quickly do they have to get up and walk?
It's about 2 hours after after the surgery, when they get out of quirófano.
Anesthesia? When they come out from the anesthesia?
When they come out from the anesthesia,
Okay.
it's 2 hours later, they start walking. It's very important to walk.
Yeah.
Because walking helps them get out all the gas.
Yeah.
So,
I know. You get used to it.
Yeah.
It is weird. You look great though.
Oh, thanks.
What about drinking? How soon after do you guys have them drink, or do you
Normally-
keep them on the IV for a day or
It's
so?
IV.
Okay.
Most of the 3 days is the IV, and then the next day of their surgery, like on the second day they're here, they start ice.
Okay,
You start-
great.
you
And
start
just letting the
ice.
ice dissolve in
Yes.
the mouth? Okay.
They start ice, and then on the third day they do that test, the fluoroscopia and the blue water thing. They
So
start
this
taking.
is the swallow test to make sure that you don't have any leaks?
Yeah.
Is that correct?
And yeah, and then if everything's okay, you take liquids, and then
Oh,
you
great.
go home.
So you don't even have them drink anything until they've taken that test?
Yes.
And then it's okay to
Then
go
it's
ahead and
okay,
drink?
right.
Wow, that's really cool.
Yeah.
Neat. And then what are the like conditions that have to be met for somebody to be released from the hospital?
Oh, that's pretty easy. As long as they're drinking okay, that there isn't they're walking. If there isn't anything coming out of the drain, there no bleeding. I mean, there is going to be some gasto, like a little bit of bleeding, but it has to be more clear. It has to be more watery, kind of like it has to look kind of like watermelon water, something like that.
Okay. Yeah.
I mean, as long as it's not pure blood, it's fine.
Okay. And that's out of the drain?
And that's
So you're monitoring out of the
yes,
drain?
and then after when they leave, we take out the drain, And you don't have to worry about if something is coming out or what's going to happen with the fluids that doesn't come out. It reabsorbs in your body.
Oh, okay.
The first 3 days is just to make sure that it's not bleeding because of the surgery.
Okay.
And then make sure that everything was stapled right.
Another question, something that's always on everybody's mind.
Right.
The nausea.
Okay.
Ooh,
That's
and
a
how
big
much
part.
are we likely to vomit, and how do you manage it?
It's normal to vomit.
It is normal to
It is
vomit.
normal
Okay.
after the surgery. The first day, the first day after you get out of surgery, it's normal to vomit. It's normal to vomit blood.
Really?
Yes, it's normal.
Because it's in your digestive tract?
Yes, because
or?
they did all the surgery, and then there's going to be residual blood.
Okay.
So that's normal.
Gotcha.
So a lot of people get scared when they start throwing
Yeah,
up blood.
I freak out.
So it's normal, and it's normal to be nauseous, especially because of the gas.
Okay. So it's the gas that makes you nauseous, not the
Yes,
anesthesia?
because the anesthesia does make you a little bit nauseous, but mostly it's the gas because
Wow.
it pressures your diaphragma,
Diaphragm?
your diaphragm, so it makes you want to like throw up all the time.
Oh.
So that's why it's very.
That's interesting.
That's why we pressure them to walk. To walk a
Okay,
lot,
because that's what relieves it. So that's going to relieve your
walking
nausea
is
too.
going to help. Right.
Wow. I always thought that the walking was just to get the gas out for the gas pain.
It's for the
not
pain and the nausea. Too,
Yeah, I
because
didn't
not
know.
everything is going to take it out.
That is so cool.
Yeah.
I'm learning so many new things. And I've already had surgery before, 6 years ago, the VSG, and there's just so much I didn't know and didn't realize. Luckily, I didn't throw up, but I
Right.
did feel really nauseous when I first woke up.
When you first wake up, it does feel really bad.
Yeah.
But that's normal. Then the second day is a lot better.
Mm-hmm.
It's all,
And it gets better and better.
Yeah.
How often would you say, and just percentage-wise, would you say people have to stay past the standard 2 or 3 days, allotted for a particular surgery because of some complication? And is it usually because that person's case is more complex and they have comorbidities?
No, actually, most of the patients here leave the third day.
So like
Every-
90%, 95?
95% of the patients leave at the third
By
day,
the third
and
day.
everybody leaves at the third day.
Wow.
No, I haven't seen many complications. I've seen only like 2.
Does anybody ever come back to the facility due to complications?
Mostly with the balloons.
Wow,
With
the
the
balloons.
Yeah.
So that's that new procedure that they started where they put the balloon down in there and then
Yeah,
float
what
it?
happens is the balloon makes a lot of pressure in your stomach, so it creates a lot of reflex.
Ooh.
And then they have problems like drinking, and they start throwing up,
Oh.
and the body like doesn't want to really want the
balloon in there. It starts
I mean,
rejecting.
but it depends on the person because there's some that tolerate it very well and they don't come back and it works for them. I guess it depends on everybody.
Yeah.
But there's a lot of people who, I have a lot more people coming back because of the balón gástrico than the gastric bypass or the gastric sleeve or something in my eye. I'm sorry.
No, I'll take it away while you're doing that. She has something in her eye. We don't want to watch her. Make her have to show us digging in her eye. So, what would you say is the most common procedure that's still done today?
Oh, the sleeve.
The sleeve
Because what I've seen more here is the bypass surgery, the normal one,
and the mini bypass.
and the mini bypass and gastric sleeve, which is the thing they
Number
do the
one.
most, and the balloon. And there's a new thing called cauterization, like a gastric cauterization.
Wow. What is
But
that?
what they do is they cauterize one of the arteries in the stomach, so it blocks the secretion of this hormone that's called grelina, and it's the one that gives you hunger.
Yeah.
So it blocks it. So what they do is they burn out basically the artery, so it doesn't get any blood from the body.
Wow.
So you can't produce any grelina,
Yeah.
so that you don't get hungry. And it's very less invasive. And I would recommend it more for people who are not that obese, who have like one, or if they're like overweight. That I think would be better for them.
I see in our community that a lot of us have a lot of psychological issues
Oh.
about food. And so
Right.
it doesn't matter if you're hungry or not.
You
it's
still
not
want-
about the
yeah,
hunger.
anxiety
You still,
and all that kind of
yeah.
stuff. Yes.
So that would not be a good surgery for somebody who's suffering from those issues.
No. Mm-hmm.
So maybe that could be for people who are just mildly overweight and
Yes.
wanting to get back to a normal
Just want
weight.
to lose weight a little bit
Yeah,
more.
because they got pregnant or
Yeah,
something
that
like
kind
that.
of stuff.
Wow. See, that's great because a lot of people I think feel left out. Like, why do I have to go to 300 pounds to be able to get the surgery and lose weight and get assistance? You know what I mean?
In this hospital, you don't need to be, well, at least with Dr. Ponce and
Mhm.
all of them, you don't need to be 300
Considered
pounds.
obese.
You don't need to be 300 pounds to get the gastric sleeve.
Mm-hmm.
You can be 200 pounds.
Oh, wow.
190
Yeah,
pounds and you
I'm
get the gastric sleeve.
195, yeah.
You can get the gastric sleeve.
Cool. Is there anything else that you want to tell me about? Like how long you've been here, how you enjoy it, working with the doctors,
Well,
all the nuances?
I've been here only a couple of months. I've only
Oh,
been,
wow.
yeah,
Okay.
about
Congratulations.
I've only been here like about 4 or 5 months.
Mm-hmm.
I'm an American citizen, but I've always lived here in Mexico. So
Wow.
I like seeing the American patients because we get a lot of American patients here. A
Okay.
lot. And the nurses don't know a lot of Spanish, a lot of English.
Mhm.
Basically, I translate a lot.
Okay. So is there always somebody on staff here like yourself that's fluent in English?
Most of the doctors here speak English.
Okay.
Most of them, yeah.
But as far as for that monitoring and daily care post-op.
Yeah, well, that's what we mean. All the doctors here that
Mhm.
stay here, like me,
Oh,
the house
okay.
doctors.
All the house doctors.
Most of them speak English.
Mhm.
Some better than others, obviously.
Yeah.
But at least we know, we understand
Yeah.
everything.
Okay.
And some of the nurses do know English.
Mhm.
Everybody in the administration knows English.
And I see that there are some ICUs.
There is, in this hospital, we don't only see bariatric patients.
Oh, okay.
So we have we see almost everything.
Wow.
And they do, but primarily it's bariatric surgery
Mhm.
and plastic surgery in this hospital.
Okay.
That's what they do. But right now, they also do transplants,
Transplants of what organs?
kidney.
Wow.
Yesterday we had one. So I have a patient right now in ICU who had a kidney transplant.
Wow, that is so cool.
Right. Mhm.
So you guys really run the gambit, which is great because I mean you're aware of every facet.
Right.
Or, I mean, not aware, but you're practicing every single day,
we
every
see,
facet
we
of
see
medicine.
a little bit of everything, right? Because
So
we
if
also
something
have,
comes up,
we also have internal medicine patients
Mhm.
like kidney failures.
Wow.
Because this hospital is called Instituto Nefrológico de Tijuana,
Mhm.
so we have there's in second in second floor
Mhm.
there's people who get hemodialysis.
dialysis.
Dialysis,
Yep.
they get dialysis.
For kidney failure.
Mhm.
So they come here and get the dialysis
Uh-huh.
treatment.
And then they go home and stuff.
Okay.
So we see a lot of people like that.
Okay. Is there any last things that you'd like to share with us?
I guess I would have to say that a lot of American people get scared because they're in Mexico. Or
Yes.
something.
Could you talk about that? That's great.
It has nothing to do with it. I mean, there
So,
isn't a difference. I don't
because
see any
you've
difference.
been in the U.S. and in here, the care is similar.
I don't see a difference.
Okay. I've actually heard some people say that the care is better in Mexico
I think
because
it-
they don't have a lot of the same regulations and stuff that hold them back.
It's different because in the U.S. you can't do a lot of things.
Yeah.
Because everybody wants to sue everybody.
Yeah.
And,
So you can't give that full care, full range of care.
the only difference I would say, because most of what I've seen is people who come from the U.S. have a less tolerance of pain.
Really?
Yes.
We're ninnies?
No. No, but I've seen
I'm
that
saying that because I am.
because in the U.S. they use a lot of morphine and a lot of very
Yeah.
controlled medications for pain. We don't use those
We're
that
way
much.
out of control. So for your American patients, do you then have to cater to them and their pain issues, or do you just give them the same regimen that you would give your?
We normally give the same regimen. If they do have more pain, we do give them more. I
Okay.
mean, we're not gonna leave them
So you're
with
going
pain.
to address the pain,
Yes, we're not gonna leave them
but
with
you
pain.
try to.
Yes,
stay mild.
a lot of it is very psychological.
Yeah.
So first of all, they have to be calm,
Mm-hmm.
and everything is gonna be fine. I mean, it's Mexico, whatever, but nothing's gonna be wrong. I mean,
Yeah.
I think medical school and all that, and basically medicine in general in Mexico is very good.
Very regulated in terms of education wise.
Yes.
And yeah. And the skill set and expectations.
Right.
You guys still have to go through medical school.
We have to go through everything. We do everything they do in the U.S. So, and we're a little bit more clinical, in my opinion.
Okay.
So,
Wow. Yeah.
So that's why I think it's fine.
Yeah. Yeah. Okay. Well, thank you so much for taking the time
Yeah, you're welcome.
to speak with us, and I'll get back to y'all soon.